Following is an introduction to food poisoning, the beginning of a series of introduction videos to understand food safety and the control thereof. Food poisoning is a common illness that occurs when you consume food and drink that is contaminated with harmful bacteria, viruses, parasites, or toxins. These harmful substances can cause a range of symptoms, including nausea, vomiting, diarrhea, abdominal pain, fever, and dehydration. In severe cases, food poisoning can lead to complications such as dehydration, kidney failure, and even death. Everybody is at the risk when it comes to food poisoning. However, certain groups are more vulnerable. Like young children, their immune systems are still developing and they may not have good hygiene practices. As well as pregnant women with changes in the immune system during pregnancy can make them more susceptible to infections, and their unborn babies can also be affected. As well as older adults, their immune systems may not function as effectively as they age, making them more susceptible to infections. Continuing with groups vulnerable to food poisoning, there are also people with weakened immune systems due to illnesses such as HIV/AIDS, cancer, or undergoing treatments like chemotherapy, which can weaken the immune system. As well as people with chronic medical conditions such as diabetes or liver disease are more susceptible to food poisoning. And then lastly, people who are taking certain medications such as antibiotics, proton pump inhibitors, and antacids that affect the digestive system. There are several different types of food poisoning, each caused by different bacteria, viruses, or toxins. First, we have salmonella, which is caused by a bacterium commonly found in raw and uncooked meat, poultry, eggs, and dairy products. Next is Campylobacter, caused by a bacterium commonly found in undercooked chicken, unpasteurized milk, and contaminated water. Then we have E. coli, caused by a bacterium found in undercooked meat, contaminated water, and raw fruit and vegetables. Next, we have norovirus, caused by a virus that can contaminate food and water and often associated with outbreaks on cruise ships and restaurants. Then we have Clostridium perfringens, caused by a bacterium commonly found in cooked meat and poultry that has been left at room temperature for too long. In addition to that, we have botulism, caused by a toxin produced by the bacterium Clostridium botulinum, usually found in inappropriately canned or preserved food. And then lastly, we have listeria, caused by a bacterium found in contaminated soil, water, animal feces, and often found in deli meats, soft cheeses, and smoked seafood.